Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. I'm starting a series on psychiatry where I'll make videos on frequently asked questions in university exams. So let's start with bipolar disorders. So here you can see mania and depression, both are there. Okay. So bipolar, also known as affective disorder, it is also known as mood disorder, or it is a type of mood disorder. So, bipolar disorder is characterized by recurrent episodes of mania or hypomania and depression with periods of normal mood in between. Okay, so bipolar disorder means there is mania or hypomania, along with that, sometimes depression also. Okay, so there is episodes of mania and hypomania, and sometimes episodes of depression also. Or you can say that bipolar disorder is characterized by episodes of both low mood and high mood or elevated mood. So this was about the definition of bipolar disorder. Now coming to etiology or risk factor, we have genetic predisposition, strong familial aggregation. Okay, then neurochemical imbalance, dopamine, serotonin, and norepinephrine. Then we have psychosocial stressors, sleep deprivation, and substance use. Okay, so these are the etiology or risk factors for bipolar disorders. Coming to types of bipolar disorders, we have bipolar 1, bipolar 2. Okay, what do you mean by bipolar 1? In bipolar 1, there is more than or equal to 1 episodes of mania with or without hypomania or depression. Okay, means mania, confirm that mania will be there, but this hypomania or depression may or may not be there. So that is bipolar 1. Okay, mania is confirmed in bipolar 1. In bipolar 2, there is episodes of mania or hypomania and depression. Okay, sorry. In bipolar 2, there is mania is never seen. Sorry, mania is never seen in bipolar 2, but hypomania and depression is seen. Okay, so we'll not confuse, we'll repeat it once again. Bipolar 1 is for sure there will be one episode, more than one episode of mania, but hypomania or depression may or may not be present. But in bipolar 2, mania is never seen, but there is episodes of hypomania and depression. Okay, understood? So this is the types of bipolar 1 and bipolar 2. We have cyclothymia. Cyclothymia is a type of persistent depression. Okay, where we'll see hypomania and mild depression. Okay, so low moods and high moods. Okay, for almost 2 years. This is cyclothymia. We have seen this in video of depression. So this is the types of bipolar disease, that is bipolar 1 and bipolar 2. Again, keep in mind, bipolar 1 will have mania and bipolar 2 will never have mania. It will have hypomania and depression. Then we have one more type, that is known as rapid cyclic bipolar disorder. Okay, rapid cyclic bipolar disorder, that is more than 4 episodes in 1 year. More than 4 episodes in 1 year. Okay, more than equal to 4 episodes in 1 year is rapid cyclic bipolar disorder. So 4 types of disorders we have seen: bipolar disorder, bipolar 1, bipolar 2, cyclothymia, and rapid cyclic bipolar disorders. Okay, this is more common in females. Okay, and in patients with hypothyroidism. Okay, now coming to the features of mania, and what are the clinical features of this bipolar disorder. So we have mania episode and we have depressive episode. Okay, so you can see the video of mania and depression. Okay, but here also we'll see in mania episode we'll see elevated or irritable mood, increased energy or activity, decreased need for sleep, pressured sleep, grandiosity, distractibility, and risk-taking behavior. So this is about clinical features of mania. Or you can go to the mania video and you can learn the mnemonic dig fast. Okay, now coming to depressive episodes. In depressive episode, I have told you in that depression video, that is EMI. EMI is decreased energy, decreased mood, decreased interest. Okay, so you can go to that video and see. But here we'll see depressive episodes. Clinical features are persistent low mood, anhedonia. Anhedonia means earlier he was having pleasure in doing the activity, but in the same activity now he don't have any pleasure, any interest. Fatigue, sleep and appetite disturbances, poor concentration, and suicidal ideas. So these both symptoms will be there on and off. Okay, this is a mixed affect state. Now coming to the management. In acute mania we have to go for mood stabilizer, also known as thymoleptics. Okay, so we have made a video on lithium carbonate. So you can use lithium or valproate. Now you can use atypical antipsychotic, that is olanzapine, benzodiazepines short terms, and quetiapine. So all those atypical antipsychotics you can use. For depression you can use lamotrigine, that is very safe, and antidepressant under cover of mood stabilizers can also be used. Remember, if this is used alone, there is drug induced mania. Okay. Now for maintenance dose you can use lithium, that is a drug of choice, that is thymoleptic apitold, and the therapeutic serum level is 0.8 to 1.2 milliequivalent per liter. You can use valproate, carbamazepine. Okay. So under psychotherapy, write all those things. Sorry, pharmacotherapy, make a heading pharmacotherapy and write this. After that, make a heading and write psychotherapy and go for psychoeducation. CBT I have told you that you can use anywhere. CBT is cognitive behavioral therapy. Then you can write interpersonal therapy, interpersonal social rhythm therapy. Okay, so you can write anything. So this was about the bipolar disorders. Thank you so much.